The last thing I want to talk about under this topic is save your siblings. And one of the most well known cases in this topic is the case of Molly Nash and Adam Nash. So, Molly Nash was born in 1994, and when she was 6 years old, it became clear that there was something wrong with her immune system. Her parents then received the news that she had Fanconi anemia, which is a deadly genetic disorder characterized by the failure of bone marrow production. Their only option, the parents' only option, was to have another child who would act as the donor to her big sister. So Adam was born in 2000, and a team of doctors performed a stem cell transplant as soon as he was born and infused his cells into Molly's circulatory system. And after about 4 weeks, Molly showed bone marrow recovery, and 3 years later, her immune system was completely normal. So Adam is considered a savior sibling who was conceived in vitro to increase the chances of survival or the quality of life of his sister. And that's what savior siblings is about. So when we use that term, it refers to a baby that's created using in vitro fertilization that was screened during the process using pre-implantation genetic diagnosis to act as a donor match for a child who already exists and is sick in some way. So the in vitro fertilization happens outside of the body. As we talked about last week, the woman takes fertility drugs to produce several eggs, which are then fertilized, mixed together in a petri dish, harvested by a doctor. Generally, there's a specific number that they harvest. The embryos are grown for 2 to 5 days, and at that point, the best embryos are chosen based on a number of factors, like how many cells they are, how even the growth is, and other factors, and then they're implanted in the woman's uterus. The pre-implantation genetic diagnosis is that process of screening these in vitro fertilization embryos to prevent inherited disorders. And it usually occurs around the third day. At this point, the embryo is 6 to 10 cells in size. They use acid to get inside the embryo, and then a pipette sucks one cell out from the embryo by securely holding that embryo in a controlled stream of acid blown through the pipette to drill a hole in the shell of the embryo. The cell is taken and screened to identify whether the fetus might develop a genetic disorder, and it's used to check if a new baby would be a donor match for an existing sick child. And when that embryo is selected and eventually born, blood from the umbilical cord is usually used to treat that sick sibling. If it doesn't work, oftentimes there's a bone marrow transplant or some other tissue or organ transplant that may be necessary at some later stage. So the idea of this Save Your Siblings really went mainstream when a famous novel was converted into a movie called My Sister's Keeper. And it allowed that idea of a Save Your Sibling to become well known throughout the country and throughout the world. And the novel is based on a family that's faced with the idea of creating a savior sibling to keep another sibling alive. In the movie, the character Kate is diagnosed with a rare and aggressive form of leukemia. And Kate begins chemotherapy, but her oncologist suggests that she might eventually need a bone marrow transplant from a related donor. The family tests their 4-year-old son, but he's not a match. The doctor suggests another unborn sibling could be a match, and the family should consider having another child in an attempt to save Kate. And so the novel is really told from the eyes of the mother, who focuses on the struggles that Kate has. Anna, the savior sibling, is a perfect genetic match for Kate, and over the course of a few years, Anna undergoes several procedures, including frequent blood withdrawals, bone marrow extractions, all of these things in an effort to keep her sister alive. And Sarah and her husband's relationship spins out of control because mom is really focused on Kate. Part of the movie, the book and the movie, is that when Anna is 13, she goes to see a lawyer and asks him to represent her because she wants to sue her parents for medical emancipation. She doesn't want to donate a kidney to Kate, who is in end stage kidney failure. And when mom is served with the papers for the lawsuit, she becomes angry at Anna. The judge appoints a guardian ad litem for Anna, and the guardian ad litem's purpose is to objectively decide what is in Anna's best interest. She takes the stand and admits that she filed the lawsuit because Kate asked her to. Hope I'm not giving any spoiler alerts if you wanted to watch that movie, or if you haven't seen it. So it's a good example. They say that this movie is based loosely on the Nash family. So if you haven't seen it and you'd like to see it, I hope I didn't spoil it too much. But really, when we talk about the issue of savior siblings, there are three main arguments that surround the idea of creating a savior sibling. One is that savior sibling would be treated as a commodity. Also, that it's a slippery slope when we're talking about selecting specific characteristics and using this the method of testing the embryos to see if they're viable or see if they have disease. Would that lead to designer babies? And the third being that what is the harm that's caused to that savior sibling? So in the first one, considering using children as a commodity, you're talking about the objective that you're bringing this child into the world under a specific condition. So creating this savior sibling is using this child as an instrument or an object in curing another child. But from a broader perspective, many couples have many reasons for having children to begin with. I want to secure my relationship with my significant other. I want to, whatever it is, economic, physiological, psychological, whatever it is, that people have children for many reasons. So it's difficult to make that claim. So the major issue is whether that savior sibling is treated in the same way as a child that would have previously been born to that family would have been treated. And as long as the parents intend to raise that child, the donor child, in the same way as other children in the family, it's an acceptable practice. There is no regulation of savior siblings in the United States. So on the other side of the argument, people say that, because they are parents that are making such an effort to be able to save one child, then that demonstrates that they are parents who are going to have the best interest of their children at heart. The second argument is that slippery slope leading to designer babies. And when you have the deliberate creation of these savior siblings, the idea is that the technique used as a first step toward allowing these parents to use embryo testing to choose the specific characteristics of their baby. And that's not a great leap to get to that overuse of that technology for designer babies. The third issue is that welfare of the child, and that's the one that really is the focus of My Sister's Keeper. And it's based on the premise of the savior sibling having an inferior life to those children who are not born to save another child. So medically, it's been suggested that this embryo biopsy doesn't seem to produce any adverse physical effects in the short term, but there's not a lot of research into whether that extraction of that one cell for testing has any effects later on. Also, there's the consideration as to whether if the donations are successful, are there more that are required? In My Sister's Keeper, she had to keep going back and doing additional treatments and undergoing additional medical intervention. In some cases, that was very invasive. So, is that fair to that person to have to go through that? And then what if it doesn't work? What is the guilt that Save Your Sibling has when the procedures don't work? So that can be harmful to the child. If the child finds out that he or she was, wanted not for herself, but for the ulterior purpose of helping that sibling to live, it can cause some psychological harm. But on the flip side, it can also be argued that that child might feel pride or contentment or, happiness in the knowledge that he or she is responsible for saving the life of their sibling. So it can have, follow either one of those two theories. Can, suffer if he or she finds out that she's not wanted for themselves, but as a means to save the life of a sibling, but also, the fact that they were able to do it, which is a heroic thing. So it can go either way. Sometimes the other issue is this child likely to have a good relationship with the parents? Are the parents going to equally nurture this child or have all of their time and energy into the sick child? So, are they able to develop that close relationship? Can the donor child or can the savior sibling understand his or her role in these events? And understand the decision of the parent to go through with all of the processes that they had to go through to get to this point. The other part is the presumption that the alternative for a savior sibling is not another life, but non-existent. So there's the argument that, people say it's harmful for them to know that they were conceived as, as a method for saving the other child. But what is the alternative? The alternative is that they wouldn't exist at all. So, framing that the way that it is presented to the child would be important. And the argument doesn't really hold weight when you have to consider the fact that, would they exist at all? And finally, I already mentioned, would they have to go through all of these physically invasive procedures? And are they able to give consent? And when do they give consent? A couple of cases that are well known for the Savior siblings topic. One is Tommy and Jerry Strunk. And I posted here for you the case law. This is back from 1969. And Arthur and Ava Strunk were the parents of two sons. One was Tommy, who at the time was 28 years old. He was married. He was an employee of Penn State Railroad. He was a part-time student at the University of Cincinnati. And he was also experiencing a nephritis, which was a fatal kidney disease. He was being kept alive by frequent treatment of an artificial kidney. Procedure couldn't be used for very much longer. Jerry at the time was 27 years old. He was deemed incompetent. He'd been committed to the Frankfurt State Hospital and School, which was an institution at the time. It was maintained for what they called then the feeble-minded. His IQ was about 35, which put him at a very low mental age. And it was determined that in order for Tommy to survive, he would have to have a kidney transplant. The whole family was tested and they were found to be incompatible except for Jerry. So Mom went and petitioned the county court for the authority to proceed with an operation for Jerry to be able to donate a kidney to Tommy. The court found that an operation was necessary and that under peculiar circumstances, it would not only be beneficial to Tommy, but would also be beneficial to Jerry because Jerry was dependent on Tommy, both emotionally and psychologically. The court further explained that Jerry's well-being would be jeopardized by the loss of his brother, more so than the loss of his kidneys. kidney.